of new treatments. Do you remember that yesterday we explained that with the CT scan, with the RECIST criteria, we have some problems to evaluate the new targeted treatments. So when we start in our institution at the beginning, we have no quantification. So we are starting with a qualitative analysis in different types of tumors. In sarcoma, treated by tumor necrosis factor. In GIST, of course, treated by imatinib, because, you know, it was the first targeted treatments in oncology. And in kidney cancer, treated by sorafenib in phase 3 during the pivotal study, and in phase 1 with the combination with the interferon. And for example, for the GIST study, we demonstrate that as the PET-CT, after 1 week, we are able to distinguish the good responder with a strong decrease of the contrast uptake compared to the bad responder. And this is an example. As you can observe, with the CT scan RECIST criteria, we have no modification of the size, but we inject the contrast agent, we have a beginning of necrosis of the lesion. And in this study, we follow the patient for 3 years. And in fact, when a patient, after 2 weeks, has a strong decrease of the contrast uptake curve, we have a very good follow-up of this patient. We have the same results with the kidney cancer metastasis, so a bad responder after 2 weeks and a good responder after 3 weeks with the necrosis of the lesion. But do you remember, it's a qualitative analysis, so a subjective analysis. And we demonstrate that it was correlated to the PFS and overall survival. And you know that now the oncologists want to have a correlation to the PFS and not to the RECIST criteria. So we move to the quantification. You know now that we must perform that from the raw linear data. And in our institution, as you can see, we perform this year more than 1,000 examinations only for the early evaluation of new drugs. We perform the modelization. And as you know, we don't know which is the best parameter. So for all study, we calculate 7 parameters. And this is an example. For example, the HEC, hepatocellular carcinoma, treated by Avastin, 2 patients, so before treatment, and after 3 days, we have a strong decrease of the contrast uptake. So currently, we perform a lot of studies, as you can see, in hepatocellular carcinoma, in GIST, in phase 1, different kind of phase 1, during the approval drugs, or with Gleevec, or with renal cell carcinoma, or in melanoma. And this technique is very useful for the phase 1 because the oncologists want to know, according to the toxicity and the efficiency, if you can monitor the drug. And currently we had these techniques in all phase 1 in our institution. So now let's move to the results. So we will go on the phase 1, or renal cell carcinoma with sunitinib, GIST with mazatinib, and HEC with the Avastin. Considering the first phase 1, it was a combination with sorafenib and chemotherapy. And the results was, after 3 weeks, we have 4 parameters correlated to the response, and all are correlated to the blood volume, under the curve, under the wash-in, wash-out, and the peak intensity. This is an example of the good responder. It was a hepatic metastasis from an hemangiopericytoma. So at the baseline, after 1 week, after 3 weeks, and after cycle 18. Compare a bad responder, it was a Merkel cell tumor before treatments and after 1 week. And this is a corresponding contrast uptake curve. So in the good responder, we have very vascularized tumor with a decrease of the contrast uptake, compare the non-responder with an increase of the perfusion. Concerning the GIST treated by mazatinib, we perform an early evaluation after 1 day, 1 week, 2 weeks, and 1 month, and every 2 months. This is an example of the good responder. It's very interesting because in this study we compare results to the PET-CT. And before the treatments, 20% of the patients have no fixation of their glucose. So this is the lesion before treatments, and after 1 week, you can see the necrosis, and after 1 month, and here the PET-CT was normalized, and after 2 months, and this is the decrease of the contrast. And concerning the parameters, 5 was significantly correlated, and the area under the curve, under the wash-in, the washout, the peak intensity, and the slope. Let's move to the renal cell carcinoma. So we perform an evaluation after 2 weeks. So this is a patient with a very superficial lesion in the B mode. When we inject the contrast agent, this is a very nice tumor because without motion. And if we have the choice between the liver metastasis and the superficial lesion, do you understand that we chose this type of target? So we follow this patient. After 2 weeks, we inject the contrast agent. And when we inject, we only see a very small area with vascularization here, but without modification according to the RECIST criteria. And it was a CT scan after 3 months and 6 months. In this study, 5 parameters was correlated to the response. So always the area under the curve, the washout, the slope, peak intensity, and time to peaks. And in this study, for the first time, we demonstrate the correlation with the disease-free survival and overall survival with a cutoff concerning the time to peak intensity. And we have a correlation to the overall survival. This is an example of a small lesion that I explained yesterday, that if you have a very small superficial lesion with a high-frequency probe, about 10 to about 10 megahertz, you are able to follow this patient. This is this lymph node in B mode with contrast agent. And after 2 weeks, and after 3 months here with a CT scan, and after 6 months with a strong decrease of this contrast. So the last study, it was the phase 2 in a hepatocell carcinoma treated by Avastin. This is an example of the curve before modelization, so before treatments, and after 1 week and 4 months, before modelization and after. So we inject this contrast agent here. And in fact, it was a good responder because this patient have the treatment for 1 year after 21 cycles. In this study, we performed the evaluation after day 3, day 7, 2 weeks, 2 months. And at day 3, the area under the curve, the wash-in, the washout correlated to the response at 2 months. And 2 parameters was correlated to the progression-free survival, the area under the curve and the washout. This is an example of the HGC, so before treatments, after day 7, after 4 months. So if we want to summarize, in a last ESMO meeting, we compared the results in a renal cell carcinoma treated by sunitinib, the GIST treated by tyrosine kinase inhibitors, the mazatinib, and the phase 1. And you understand that the area under the curve, the washout, and the peak intensity are always significantly correlated to the RECIST response. So probably this type of parameters is able to predict this response. So this methodology currently is extended to 18 centers in France in order to determine which is the best parameters according to the vascular distracting agent or for the TKI or for the Avastin, and which is the best timing after 1 week, after 2 weeks. So we are 18 centers, 11 outside of Paris, and 7 near Paris. And 650 patients will be included. So patients with metastasis from colon cancer, melanoma, breast cancer, GIST, renal cell carcinoma, where the targeted treatments are approved. And we will perform an evaluation after 1 day, 1 week, 2 weeks, and every 2 months. And currently 263 patients are included in 1 year. And probably this study will be reinforced the results that we'll have in our institution. But currently this methodology, the early evaluation of new drugs, is not approved under guidelines. So we hope that this indication will be had in the HEPSUM guidelines. Thank you for your attention.